So today you came in having a little bit of difficulty breathing. We adjusted you and
Yeah, right there it was like a click. That's it. I felt like I was reborn after the adjustment.
hi, I'm Dr. Brian Hutchison and here with me is Karim. Karim, you and I have been working together since the end of 2020. And when you first started coming until now, could you tell us a little bit about the symptoms that you were having and how curve correction and adjustments have been a part of your recovery?
So for the symptoms I was having, there was heart palpitations, high blood pressure, anxiety attacks. Half my body was 10 degrees hotter on the other half, from the other half. The optic nerve was 0.5 centimeters. That's how swollen it was. But and then I couldn't find anybody to help me out with the symptoms, and it was all due because of my straight neck.
Got it. And when we first started working together, we found a certain kind of curve correction that worked for you. And you said that you did it pretty much religiously, right? Every day you were wearing the weights and you would notice, what would you notice when you wore them? Or what do you notice still?
I noticed pain level, it gets down.
Okay.
And whenever I used to get symptoms, I used to wear those weights. Those 2 minutes, 3 minutes, twice a day or 3 times a day, and they really help
Good.
on restoring the curve. Also, I start noticing that I'm getting better by holding the weights more time on my neck. I started I think we started within 2 minutes,
Okay.
twice a day, up till 15 minutes, increasing
Wow.
every time we come back, check on the curve. It was increasing every time we come in. So
When you first started, you had a significant amount of forward head carriage. Your skull was almost resting on your atlas. You had cervical instability, both upper and lower.
yeah,
And you were able to start curve correction almost immediately in your journey.
yeah,
So even while you were getting your instability treated, you were still doing curve correction to help optimize the forces on the bones.
yeah,
Because we know that if your neck is really far forward and you have a poor posture, that the effect of regenerative procedures may be dampened because there is abnormal force on the ligaments every time that you move, every time you're upright.
yeah.
So it was pretty neat that we were able to start right away working on restoring a better curve. You now have a pretty straight cervical spine. And just today, what did you see on the x-ray when we fine-tuned it today?
It was a nice lordosis.
Yeah, a nice lordosis for the first time.
Yeah.
So your case has taken a while and you've been doing so much better, Karim. You're not really getting the heart symptoms. You feel temperature is more regulated side to side.
Yep.
Your anxiety is down drastically. But you noticed that there was still something lingering. There was something in your mid-back, something pulling out, causing a little bit of chest tightness and
Yep.
an occasional palpitations. You're like, oh man, I better address this before some of the symptoms return, right?
Yep. Yep.
So today you came in having a little bit of difficulty breathing. We adjusted you and
Yeah, right there it was like a click. That's it. I felt like I was reborn after the adjustment.
that is amazing. So yeah, you could take a really good deep breath.
Yep.
You felt like you were reborn, just like a really more centered and aware and in control of your body.
Yeah. I mean, when I come in this morning, I was like, yesterday I had a very difficult night. I trying to breathe, I couldn't breathe normally. So taking a flight from Raleigh, Durham down here, I was still not breathing normal. As soon as I step into Dr. Hutchinson's office after the first adjustment, right there, I was just, it's like a cloud on like right in front of me, and it just cleared. I was able to breathe normally.
That's amazing.
Yeah.
Thank you so much for your testimony. And I think that now that we changed your plan today, for the first time, Karim, your neck was so far forward before that we could only work on addressing one part of the curve correction.
Yeah.
And now that it's so strong and it's in a neutral position, we were able to get that lordosis. And we're just so excited for you to continue on your path towards feeling amazing and needing less and less care as you continue to get better.
Yeah.
Thank you.
so much.
You're welcome. Thank you too.
Yeah.
Okay.